let's talk about art assessments. So personally, I love an assessment. I was the assessment queen, as my supervisor told me during grad school. I absolutely love it. It's like a little test that you can give your client or your patient and really kind of like dive in like head first and get some answers. So I like to use them as like a baseline, as like a starting point when I am dealing with somebody new and kind of, warming them up into the creative outlet that art therapy offers. I also find it less intimidating than like that question that you get, which you feel is like a battery, and it's just incessant at times. And especially working with a younger clientele, sometimes it's overwhelming. So this is kind of like that, just easy, let's just draw something, build some rapport, and they don't even know that it's actually an assessment half the time. So art assessments are great for seeing where your strengths lie. So that will help the therapist down the road knowing, okay, so they did great with that assessment working with crayons, not so great when they worked with markers. So even just things as a material basis, but also maybe the assessment itself, what can trigger them, and that's so useful when you are dealing with a new patient. Lastly, it's great for treatment planning, so it helps me or the other therapist to tailor the goals of our treatment plan. So like I had mentioned before, it could be materials based, or maybe it's topics that I know to stay away from, but this is such a helpful tool. I'm not sure if you ever heard of them, but I am gonna share a few with you in my next few videos. So stick around. I have a few of popular, more go-to assessments that we as art therapists like to use with our clients. I'm Jean, and I'm an art therapist.